Imagine waking up one morning to the news that you might receive a $1,400 check, not as a loan, not as a tax credit months from now, but as direct, one-time payment on top of your Social Security benefits. For millions of retirees, SSI and SSDI recipients, that kind of boost could mean paying off overdue bills, stocking up on groceries, or finally catching up on medical expenses. But here's the big question. Is this just another proposal that will fade away like so many before, or could it actually happen this time? Today, we're breaking down the details of a major proposal gaining national attention. It comes from the Senior Citizens League, a respected advocacy group, and it calls for an immediate catch-up payment to help seniors keep up with rising costs. We'll explore how it would work, why it's being pushed now, and whether it has a realistic shot at becoming reality. By the end, you'll have the full picture. And I want you thinking about whether this would be the right move for Social Security or just another false hope. The Senior Citizens League, often referred to as TSCL, has just reignited the national conversation about boosting Social Security benefits. In a formal statement and press release, they outlined a plan for a one-time catch-up payment of $1,400 for every Social Security beneficiary, not just retirees, but also those on SSI and SSDI. According to TSCL, the idea is to provide a short-term financial lifeline for seniors and disabled Americans struggling with rising prices. This proposal, while new to headlines, has been on TSCL's radar for weeks. The organization has been tracking inflation, cost of living adjustments, and the increasing gap between benefits and expenses. Their position is simple. The annual COLA increase is not enough to protect beneficiaries' purchasing power, and a direct one-time payment would immediately address some of the shortfall. The fact that it's now breaking into the mainstream media suggests there may be growing support, or at least growing recognition, that more help is needed. Timing is everything in politics, and this $1,400 proposal is surfacing at a moment when inflation, COLA predictions, and public frustration are intersecting. On August 9, 2025, several major news outlets began covering the idea after TSCL's statement began circulating widely. The renewed attention comes just as the 2026 COLA projection ticked up slightly to 2.6%, which many advocacy groups still say is far too low to meet seniors' needs. This slight COLA increase isn't enough to match the actual cost spikes in essentials like housing, utilities, and prescription drugs. TSCL argues that waiting for a slow, modest benefit adjustment in January doesn't help those who are already falling behind today. By proposing the $1,400 check now, they're seizing the media moment and pushing lawmakers to address the gap before it widens further. The question is whether this momentum can be converted into actual legislative action. We've seen similar ideas before, and many have failed to cross the finish line. During his 2020 campaign, President Biden proposed adding $200 per month to Social Security benefits, an idea that would have put $2,400 extra into recipients' pockets each year. Around the same time, lawmakers like Bernie Sanders and Elizabeth Warren introduced the Social Security Expansion Act, which called for higher monthly benefits and the elimination of taxes on Social Security income. Despite public interest, those proposals stalled in Congress due to political gridlock, budget concerns, and shifting legislative priorities. That history is important because it shows the challenge facing the current $1,400 proposal. TSCL's plan differs in one key way. It's a one-time payment, not a permanent increase, which means it might be easier for lawmakers to approve since it doesn't commit the government to higher annual payouts. Still, past failures mean many seniors will be cautious about believing this will happen until they see it in their bank accounts. TSCL's reasoning is straightforward. Inflation has eroded seniors' buying power to the point that even modest expenses can cause financial strain. Groceries, rent, home repairs, and prescription medications are eating up larger portions of fixed incomes, and the COLA increase each year hasn't kept pace with these costs. A $1,400 one-time payment could give seniors immediate breathing room to cover necessities without taking on debt or sacrificing their health. The advocacy group also emphasizes that Social Security is an earned benefit, Seniors paid into the program over decades of work through payroll taxes, and now that they're drawing benefits, they should be able to rely on them for basic needs. TSCL frames this not as a handout, but as a corrective measure to offset the failure of current COLA calculations to fully protect recipients. That framing could help build bipartisan support as it shifts the narrative from aid to fairness. The annual COLA adjustment is calculated using the CPI-E, the Consumer Price Index for urban wage earners and clerical workers. TSCL and many other advocacy groups argue that this is the wrong measure for seniors. CPI-W tracks the spending patterns of working-age households, which often have very different expenses than retirees. For example, it gives less weight to healthcare costs, which make up a significant portion of senior budgets. TSCL is pushing for the adoption of the CPI-E, the Consumer Price Index for the elderly. This measure more accurately reflects the cost pressures seniors face, particularly in healthcare, housing, and utilities. In a recent survey, 96% of Social Security recipients said they want COLA to be based on CPI-E instead of CPI-W. This change wouldn't require seniors to wait for one-time proposals. It would make every COLA increase better aligned with their actual living costs. Inflation isn't just a headline number, it's felt directly in seniors' wallets. Recent spikes in food prices, energy bills, and rent have outpaced COLA increases, meaning that even with an annual adjustment, seniors often end up with less buying power than the year before. This is particularly damaging for those who have no other income source besides Social Security. On top of inflation, rising Medicare Part B premiums have been eating into the COLA increases almost as soon as they're announced. In some years, these premiums have risen so sharply that they've effectively erased the entire benefit increase. TSCL argues that this double hit, inflation plus premiums, is a big reason why a one-time $1,400 payment is urgently needed. The proposed payment would be similar to past direct relief programs. In 2009, for example, eligible Social Security and SSI recipients received a $250 economic recovery payment. During the COVID-19 pandemic, stimulus checks went out to millions of Americans, including Social Security beneficiaries, with funds deposited directly into the same accounts where monthly benefits arrive. TSCL suggests that the $1,400 payment could be delivered in much the same way. No separate application process, no complicated paperwork. The Social Security Administration already has the payment infrastructure in place, meaning funds could be sent relatively quickly once approved. This simplicity is part of what makes the proposal appealing to many seniors and politically viable for lawmakers. While every Social Security recipient would get the $1,400 under this proposal, certain groups would feel the impact most. TSCL research shows that 7.3 million seniors live on less than $1,000 per month. For them, a one-time payment could represent more than a full month's income, helping them pay overdue bills, cover winter heating costs, or finally address medical needs they've been putting off. Additionally, 39% of beneficiaries rely on Social Security for 100% of their income. These individuals have no pension, savings, or other financial cushion. In many cases, they are choosing between essentials, food or prescriptions, rent or utilities. For these seniors, $1,400 isn't just extra money, it's a lifeline that could help stabilize their situation, at least temporarily. The recent passage of the Big Beautiful Bill included a $6,000 tax credit for seniors earning less than $75,000 annually, or $12,000 for couples earning under $150,000. While that sounds generous, the reality is that many low-income seniors won't benefit because their incomes are too low to owe taxes in the first place. This is where TSCL's proposal becomes more relevant. It would put cash directly into seniors' hands, not just reduce a future tax bill. TSCL's argument is that while the Big Beautiful Bill is a step forward, it doesn't address the needs of the most financially vulnerable seniors. A direct payment bypasses the limitations of tax credits and reaches those who need it most right now. This distinction could make the $1,400 proposal an important companion policy rather than a competing one. Surveys show overwhelming public support for strengthening Social Security. In TSEL's latest poll, 93% of respondents said Social Security and Medicare reform should be a high priority for Congress and the president. This is not just a senior issue. It's a national issue, as millions of Americans are either receiving benefits now or will in the near future. Interestingly, 4 in 5 seniors believe that inflation was higher than the official government figures in 2024. This sentiment reinforces TSEL's argument that COLA calculations are out of touch with reality. Public opinion like this can be powerful in shaping legislative priorities, especially if constituents are vocal about their support for a one-time payment. It's important to remember that this $1,400 payment is still just a proposal. It hasn't been introduced as a formal bill in Congress, and without legislative backing, it won't move forward. Lawmakers will have to weigh the cost against the potential benefits, and there will almost certainly be debates about how to fund it without worsening the Social Security Trust Fund's long-term outlook. However, one-time payments are often easier to pass than permanent benefit increases because they don't require ongoing funding. If the proposal gains bipartisan support and is framed as emergency relief, it could stand a better chance than past long-term expansion plans. The real test will be whether it can gain enough traction in both the House and Senate to reach the president's desk. So, here's where things stand. A $1,400 one-time payment for all Social Security beneficiaries is officially on the table, backed by one of the nation's largest senior advocacy groups. Whether it becomes reality will depend on political will, public pressure, and the willingness of lawmakers to act before the gap between benefits and costs grows even wider. Now, I want to hear from you. If you had to choose between a one-time $1,400 payment or permanent reform to make COLA more accurate for seniors, which would you pick and why? Drop your thoughts in the comments, hit that like button if you value these updates, and subscribe so you never miss important news that could impact your benefits.